First, regarding the outcome of women who have an ER-positive breast cancer, which is an endocrine-sensitive disease. It has been always claimed that maybe pregnancy in these women is not a good idea because pregnancy has there are high estrogen levels during pregnancy, and maybe in this particular subset, this could not be a very good idea. Another thing we've noticed that there are around 30% of women who became pregnant after breast cancer diagnosis were advised to go for an abortion, mainly by their treating physicians, which underscores the uncertainty in the data we have regarding the safety of pregnancy in these patients. Also, other questions remain regarding when to become pregnant, the safety of breastfeeding. All of these points were not really addressed in the previous studies. So we opted to design a study in order to try to address these particular points: safety in ER-positive, impact of abortion, when to become pregnant, and outcome according to breastfeeding status. I had a follow-up of around 5 years following pregnancy, and we did not find any detrimental effect of pregnancy on the outcome of patients with an ER-positive breast cancer. We conducted the same analysis in the ER-negative population, as well as the overall population, irrespective of ER status. And as well, we did not find any detrimental effect of pregnancy on breast cancer outcome. Well, this was the main analysis, which emphasizes the point that pregnancy is safe after breast cancer diagnosis, even if a woman has an ER-positive disease, so an endocrine-sensitive disease. Of note that most of the women that received hormonal therapy, well, the standard of care in premenopausal women, that women received hormonal therapy for 5 years. Most of the women who received adjuvant hormonal therapy in our study completed the 5 years. So this study did not really address the feasibility of early interruption of hormonal therapy, which is crucial because some women come to the clinic and they are concerned that they don't want to wait for 5 years to become pregnant. Well, the hormonal therapy itself could affect their chances of becoming subsequently pregnant. So this study does not address the feasibility of, for example, giving 3 years or 4 years or just stopping at 2 years. What we can say from this study that every woman should complete adequate hormonal therapy in order to become subsequently pregnant. We did not find that abortion improves the outcome of these patients. So patients who had an abortion or completed their pregnancy, they had similar outcome and similar to their comparative group as well. So underscoring again that the concept of maybe we are reducing the risk, the potential risk of relapse with pregnancy by inducing an abortion, well, this is not true. So women should not be advised to go for an abortion for therapeutic purposes. Unfortunately, we had very limited information to comment on breastfeeding, so very limited information was available on the breastfeeding status of those who became pregnant after breast cancer diagnosis. So only 25 women were known to have breastfed their children, and around 40 women were known not to have breastfed their children. The rest had an unknown breastfeeding status. Of course, the numbers are too little to draw solid conclusions. However, we did not find really a trend of a poor outcome or anything, but we cannot, of course, confidently conclude on that.